2 segments, right? So what do you think about that? Does that increase anything for you? So again, look on your phones. If you're doing it on your phone, you should see post. It's TAN, like TANCIT, TAN DC. So it's TAN DC, and it should say post 1 and post 2. Okay? And again, if you decided not that the phone doesn't work for you, look in your packet and just fill that out for the post survey, post 1 and 2.
Okay. Give you a second to fill out those questions and have the survey. It's really important. And while you're looking at that, I'm going to tell you about our next speaker, Dr. CONSTANCE MERE, who is a nephrologist, and you just heard about kidney disease and the problems that's there. And so we're bringing you the kidney specialist, which is called the nephrologist. She's assistant professor and a nephrologist at the Department of Medicine at Howard University. She comes to us from Nigeria, and she works, and this is really important, she is one of 6 doctors at Howard University and one of 26 at Georgetown who specializes in nephrology. So there's not a lot of nephrologists, and certainly there's not a lot that looks like Dr. Mere. So it's really important that you're going to get this information. So she is trained in the diagnosis and treatment of diseases that affects the kidneys, and we are diagnosed from kidney disease. So it's chronic kidney disease and kidney disease as it relates to myeloma and other conditions in other populations. So it's really important to hear about that. And she is what is called the super doctor in the practice of nephrology. And while she looks like she's only 23, I understand she's been in practice for 23 years. I don't know. Dr. Mere.
That reminds me of the age of Madeline, Adeline rather, the lady that never gets old. Well, thank you so much to 50 Hoops, Mount Airy Baptist Church, and the Multiple Myeloma Research Foundation for putting this together. I think it's really very important. I'm a physician, but I like to think of myself as an educator first. So Dr. Ali and I, we're assistant professors at Howard University Hospital, and we teach. We teach our patients, medical students, the resident doctors, so the doctors in training, and also we learn from each other. So almost every speaker who came up here talked about how multiple myeloma affects the kidneys, and that's what I'm here to talk about. As a kidney specialist, the role I play in the management of multiple myeloma. So like Dr. Ali, we're specialists, so we're not primary care physicians. So primary care physicians refer patients to us because I think there's an issue either with the kidneys, in my case, or in Dr. Ali's case, with the blood. So for me, what they see is an elevated serum creatinine. So there's a blood test to check how healthy the kidneys are, and it's called the creatinine. Creatinine is a muscle protein that is filtered by the kidneys, and when the kidneys' function is impaired, it builds up in the blood, and the levels are high in the blood. So when the primary care doctor detects that, they refer to a nephrologist, maybe after repeating the test and confirming that it's elevated. So knowing that multiple myeloma, or 50% of multiple myeloma patients develop kidney problems, that is one of the screening tests I do on almost every patient who comes my way, unless there's an obvious reason like diabetes or high blood pressure. Even then, I still screen because one person can have 2 or 3 disease conditions at the same time. So, you don't pick one condition and stick with that. Unfortunately, some people have more than one diagnosis. So there are other things that make me think more of multiple myeloma. So besides the high blood test, the high blood creatinine test, if they have high blood calcium levels, that makes me think of multiple myeloma. If they have abnormal protein in the urine, so anytime someone wants to test how healthy your kidneys are, they do a blood test for creatinine. They use that to estimate how well your kidneys are filtering the blood, called the GFR for short. They test the urine for protein. So we look for proteins that occur normally in the blood, albumin, and we also look for other proteins like the myeloma proteins, the light chains in the urine. So when I see abnormal proteins in the urine or in the blood, I refer to Dr. Ali for testing. So the reason why a lot of multiple myeloma patients have kidney problems is because the kidneys are the filters of the blood. A whole lot of blood, more than a quarter of the output from your heart. When your heart, each time your heart beats and pumps blood out, more than a quarter of that blood passes through the kidneys, and the kidneys filter the blood. So, and because the myeloma proteins are, you have a lot of them in the blood and it passes through the kidneys, they get into the kidneys and wreak havoc there. They cause different kinds of damage in the kidneys. Some cause inflammation, some block the tubules, the filters in the kidneys. So different ways, and there's some conditions that increase your chances of having kidney damage from multiple myeloma. For instance, if you're dehydrated, it's likely that those proteins will concentrate in the kidneys and damage the kidneys more. If you take certain painkillers that are very common, you don't need a prescription to get, like Advil, ibuprofen, Motrin, those can increase your chances of having kidney damage from the myeloma proteins. So before you take, if you have that pain that is lingering and not going away, it's better to take Tylenol or acetaminophen or an aspirin instead of the Advil or ibuprofen, because it may actually be causing more damage to their kidneys because of that pain is myeloma. So, and I guess you get it empowered, educating yourself through foundations like the Multiple Myeloma Research Foundation, or in terms of National Kidney Foundation, can help you understand more what your symptoms are and how to lower your risk of developing more complications. So what I encourage everyone to do, those who have multiple myeloma, who have been diagnosed or think they have it, or people in general, make sure you drink plenty of water. So what we call plenty of water is drink enough to make sure you're not thirsty all the time. Okay, so and also make sure you're making a lot of urine when you drink the water, because if you're retaining that fluid, then you shouldn't be drinking that much. So if you're swallowing up and you're not putting out a lot of urine, you shouldn't be drinking that much. And then avoid those painkillers if you've been diagnosed with multiple myeloma. If you haven't been diagnosed with multiple myeloma and you have chronic pain, just check with your doctor before you self-medicate. Yeah. The other thing I want to talk about regarding the multiple myeloma and kidney failure is, so there are different stages of decreased kidney function. Treatment of the multiple myeloma sometimes can reverse the decreased kidney function if it's earlier on in the stage. But in advanced cases, with treatment, the kidney function doesn't improve, and the patient might need dialysis, which is a way to purify the blood. So you use an artificial kidney to remove the waste from the blood, since the kidneys are clogged up and can't do that. But regardless of whether the kidney function improves or not, it's still important that the multiple myeloma is treated. So I have patients who are on dialysis, who have been on dialysis for years and still getting multiple myeloma treatment. Even though that part of the complication of multiple myeloma wasn't reversed, it was still important to keep them alive by treating the multiple myeloma. Yeah. So I'm going to stop here and take questions. I mean, there's a lot to talk about, but I think I'll have some more to say when I get a question to answer.